DSM-5 Substance Use Disorder Assessment Checklist. Video created by Dr. Rigoberto Tapia. A pattern of substance use leading to clinically significant impairment or distress is manifested by at least two of the following, occurring within a 12-month period. 1. The substance is often taken in larger amounts or over a longer period than was intended. 2. There is a persistent desire or unsuccessful efforts to cut down or control the use of the substance. 3. A great deal of time is spent in activities necessary to obtain the substance, use the substance, or recover from its effects. 4. Craving, or a strong desire or urge to use the substance. 5. Recurrent substance use resulting in a failure to fulfill major role obligations at work, school, or home. 6. Continued substance use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of the substance. 7. Important social, occupational, or recreational activities are given up or reduced because of the use of the substance. 8. Recurrent substance use in situations in which it is physically hazardous. 9. The substance use is continued despite knowledge of having a persistent or recurrent physical or psychological problem that is likely to have been caused or exacerbated by the use of the substance. 10. Tolerance, as defined by either of the following. A need for markedly increased amounts of the substance to achieve intoxication or desired effect. Or B. A markedly diminished effect with continued use of the same amount of the substance. 11. Withdrawal, as manifested by either of the following. A. The characteristic withdrawal syndrome for the substance. Or B. The substance is taken to relieve or avoid withdrawal symptoms. Symptoms 10 and 11 are not applicable if the client is using sedative, hypnotic, anxiolytic, opioid, or stimulant medication as prescribed consistent with physician's orders, e.g. not combining with synergistic substances, not taking more frequently or in greater quantity than prescribed, not operating machinery, etc. The diagnosis of a SUD requires a level of severity using the following criteria. Mild substance use disorder, 2 to 3 symptoms. Moderate substance use disorder, 4 to 5 symptoms. Severe substance use disorder, 6 or more symptoms. The diagnosis may also state if the condition presents with or without pharmacologic dependence. With pharmacologic or physiological dependence. Without pharmacologic or physiological dependence. Finally, assign a level of remission if qualifies and if on maintenance therapy provide medication name. In early remission, no symptoms, except for craving, for 3 to under 12 months. In sustained remission, no symptoms, except for craving, for more than 12 months. On maintenance therapy, if taking a prescribed agonist medication and none of the criteria have been met for the agonist medication except symptoms 10 and 11.